How many people here are practitioners? Okay, and I know we have some salespeople. How many salespeople do we have in the room? It's got to be a couple. So this is what I want to change. I want all the practitioners in here to realize that you have a salesperson inside of you, and you need to embrace your inner salesperson. So I read a book not too long ago by Marcus Buckingham called Stand Out, and in that he identifies your key strengths. And one of these strengths is provider. I would say the majority of you here are providers. And what does that mean? You put others' needs before your own. And how does that apply to your practice? Oftentimes you feel guilty charging money, or you feel bad when you think about, your office from a business perspective and not just for your patients. But my guess is that all of you want to treat more people and have an impact on more people. And the only way that you can do that is that if your practice thrives and that you can see more patients. And so now you have to think like a salesperson. So I want to step back and let's pretend I'm John or Jane Smith. And I've been feeling sick for like the last 6 months or 6 weeks. And I decide that it's time to see a doctor. Do I call your office, pick up the phone and call your office? No. I take out my phone and I page Dr. Google. Because I'm looking for people who have had similar experiences, and I'm looking for answers and advice from these people. And oftentimes, maybe next, what I do is I go down a couple rabbit holes, and I search Lombard, Illinois, doctor specializing in this particular condition. And does your name show up? This is the first way that you can be more of a salesperson. I talk about this with my functional group all the time. Do you have a web presence? If you don't have a website, you don't exist. So now let's take a little step forward. We don't want to get too far into that. I'm John Smith again, and I walk into your office for the very first time. You need to sell me on your office. Patients expect a med spa. No longer can you have wallpaper in a sterile environment. You go to a bowling alley now and there's lounge chairs and nice food and cocktails. This is what they want when they come to your office. They want this med spa that they've seen on TV. Because when people see more value, this is perceived value, this is a very easy way to justify maybe some of the cash-based prices that you have in your office. Okay, so now I step into the exam room and you walk in. You have a very short period of time to sell yourself. Are you the expert? Why should I come back here? Why should I be spending money at this office? You need to instill all these things into me and make me buy into you. No longer do patients just go online or call their insurance company and find a doctor that's 5 minutes away that takes their insurance. They want a doctor that they believe in, especially when it comes to functional medicine. If I have a cough, yeah, maybe I'll go to the local clinic that takes my insurance. If I have a chronic condition, I'm looking for a doctor that I can believe in. You need to sell yourself. The next thing you need to do is sell me on the diagnosis. Because like I said, I've already paged Dr. Google. I've talked to my friends. I've talked to my colleagues. I know what I have, and I'm telling you what I have. But wait, I'm wrong? You have a different diagnosis for me? You need to sell me on this diagnosis. You need to make me buy into this diagnosis before I'm even willing to do anything about it. The last thing you need to do, and this is what I want to spend a little bit more time on, is you need to sell me on the treatment. If any of you were a typical primary care doctor in a traditional setting, if I were John Smith and I came in and I had elevated fasting blood glucose and elevated A1C, you'd say I'm diabetic or pre-diabetic depending on where my numbers are, and you'd probably give me metformin. Well, that's easy. I go, I spend a couple dollars a month, I take a pill a day, and I change nothing else. But instead, you're functional medicine doctors. You tell them to change their diet and lifestyle. A 15-minute, 10 to 15-minute metformin visit just turned into an hour introductory to lifestyle medicine. So are you able to charge for that? And are you charging for that? And do you feel guilty for charging for that? Those are the things I really want you to focus on, because you're going to ask this patient to spend an hour with you. You're going to tell them to come back in 2 weeks. And then you may ask them to join your wellness program. And there's nothing wrong with charging a profit or making a profit on these wellness programs. And this is where you need to get out of your provider mentality and realize that, yes, at heart, you're all entrepreneurs. You're all running an office. So let's think about this from another very large expense we have. Most of us have cars. I put about 40,000 miles a year on my car. I drive a ton. But when you think about that, I get an oil change every single month. I have to get my tires rotated. I need brakes. I need new tires once a year. I never reach into my pocket and take out my insurance card for any of these things. I pay cash for them. I will never put as many miles on my car as I put on my body. Your health can be a long-term liability, or if you invest in it, it will be a long-term asset to yourself. So what I'm telling you is you need to embrace your inner salesperson, be comfortable for charging and making a profit on the services because you're doing a lot more than other physicians are. So next time somebody like me comes in the room and asks, where are the salespeople? I'd like you to raise your hand. Thank you.